everyone, this is Dr. Kasturi, a very young and passionate homeopath. Today we are going to talk about a topic which is proposed to me by Dr. Vikas, a homeopath. He has his channel named as a homeopath on Instagram, and he also has his own YouTube page, and a lot of followers are watching him, a lot of viewers are there, a lot of students follow him. So basically he came up with the idea that everyone is well aware of the idea of case taking, which is not really true because the art of case taking is really mysterious. It does not have any specific rule. It's a long process. Sometimes it happens in seconds, sometimes it takes like really long hours to investigate that one single remedy which is suitable to the patient, that one unique remedy of the individual. So in context with that, I would like to share a few points on what not to do in case taking, because that is equally important. Students start taking cases when they are in second year, third year. I personally started my practice when I was in third year, and I believe it has been of immense help to start your practice early on. It gives you immense confidence, though all cases are not 100% successful, because homeopathy is a little bit complicated, more complicated than allied sciences, and it's not very easy to practice. But there are certain pointers if you follow, and there are certain ways if you really are passionate, and if you're focused enough, you do find ways in which you understand that case taking is not very difficult, and coming to a similinum is not very difficult. Anyway, so the points that I would like to cover in don'ts of a case taking: do not, number one, never ever make a very tense kind of atmosphere. Release the tension in your room and just make your patient feel absolutely comfortable. I mean to say, we, not just homeopaths but medicos otherwise, are always in the urge of expressing our words through medical terms and use a lot of hi-fi dictionary words. The patients are not used to them all the time, right? So rather than focusing much on diagnosis, especially a homeopath, he must be knowing the diagnosis of the patient, right? But using those terms again and again in front of the patient will not lead to what you want in your practice. In homeopathy, understanding the deeper patterns of the patient is more important than just understanding the diagnosis and coming to a very superficial evaluation. We need to know the person as a whole. So in context with that, I would like to say that do not make a very dominating atmosphere of medical terms. Just avoid using those words. Secondly, I would like to talk about cut down the waiting time for your patients. You better keep an appointment basis clinic atmosphere, or whatever suits your setup. So homeopathic cases are a little bit longer, half an hour, 1 hour, sometimes 2 hours, 3 hours. It varies from patient to patient, from the patient's condition. And all I would like to say is, do not keep them waiting, because we do not want anyone to get frustrated, and then the patients will not like that kind of behavior. So just a part of etiquette, and also to save your time and the patient's time, keep it on appointment basis. Thirdly, I would like to say that do not really get emotionally involved with the patient. Yes, you hear me right. I'm saying this with great responsibility, especially when you're taking a case. See, a homeopath is a compassionate, is an empathetic person, a listener, a keen observer. Agreed. But the moment you get emotionally attached to the patient's story, you will forget your case taking. You will forget what is to be done. You will start perceiving things in a different way and not the way they are. And in homeopathy, it is important that you see things exactly the way they are, meaning the patient perceives according to his own perception. So whatever delusion he or she has, you just go by it and try to understand the patient's deeper levels, the inner aura, the inner sensation. If you're doing sensation method, you will know this well. Anyway, but all I would like to say is, don't get emotionally attached, especially if you're taking a case, right? And that is really important. You want to understand the problem, you want to understand the person, you want to understand the cause, but not get involved in the story of the patient. The story is not important. The pattern is important. The inner aura, the inner soul is important, where you want to come to a fine remedy. Then no leading questions, please. No leading questions at all. Do not ask questions like, do you like this or do you like that? No. Don't make them answer questions in such a way that they would give you answers in yes or no. Open-ended questions only. How do you feel in summer, right? How do you react to summer? How do you react in winter? So you don't have to ask them things like, are you chilly? Are you hot? These are homeopathic terms, but Don't just ask very direct questions. You have to give them their space. Number one should come: do not interrupt. Please do not interrupt when a patient is with a chain of thought and he has something really important to tell you, especially the first 10 minutes of a case taking. Please remember, these are really, really important times where patient will give you very peculiar symptoms, very intensified symptoms, very spontaneous symptoms, and I want you to focus on those symptoms, those hilarious symptoms, right? So do not miss out the chance. I would also like to add that do not pressurize the patient in any way. If he's not comfortable to speak about certain spheres of his life, let it be. Just give him or her the freedom, and whenever they are comfortable at the time of follow-up, you'll be able to get through him. Also, a few points about no double barrel questions, like do you feel better by bending forward, also do you feel worse by bending backward. No questions like that. Modalities, yes, sometimes we do have to be clear and we do have to ask them direct leading questions, because then it becomes difficult to confirm. So yeah, we don't think like we're becoming unprejudiced and things like that. We just want to find picture a great portrait of the disease. So all I would like to say is just focus on the symptom. For example, the patient says, I get toothache on waking up. So you have to confirm whether it's waking up or whether it's rising up, because there's a difference between the two. Rising is getting up from the bed. Waking is when the eyes open first time in the morning. And you would also want to know certain things, that before brushing the teeth, the toothache is aggravated, after brushing, or during breakfast, before breakfast. What is it exactly? What is the exact modality that you want to confirm with the patient to come to a final and a very, very short prescription, right? Also, do not miss out accessory symptoms. There are patients who feel constipation for 4-8 days is normal for them. They're habitual to it. So these are certain accessory symptoms which patients think are natural, but you need to rule out. So do not give them a chance to be absolutely okay with their accessory symptoms. I would also add certain points in do not be in a hurry. Do not be in a hurry to take the case. Do not be in a hurry to end the case. And also do not be in a hurry to prescribe the similinum. If you're not sure about the remedy, you can give SL in the meanwhile, but get your remedy really, really short and then try to prescribe and make your cases successful. Till the time, I think this is enough, a short real kind of video, and I hope you get some information out of it. Try to apply in your practice and let me know how you feel. This is my first ever video, a very random one. It's I think 1:30 a.m. tonight, and I know it's crazy, in the middle of night I'm giving a lecture or something like that. But yeah, do let me know about what you feel about it. And also do let me know if you want some more videos regarding homeopathic case taking, because homeopathic case taking is my soul mate, you can say. I love doing that. Thank you. Bye bye. Take care.